Hello everyone, I'm Dr. Kamal Bhalla. I'm a consultant physician at Sagar Hospital's Kumaraswamy layout. I'm going to talk about diabetes, which is one of the most common diseases that we see in India. If you would like to know, more than 8 crores of people in India have diabetes. And more astonishingly, even now, almost 65 to 70% of these patients do not have an adequate sugar control. This is a huge number. We all know about diabetes, we all know the treatment options available, we all know the diet control, but still, I find a lot of patients come in with complications of diabetes because of uncontrolled sugars. These complications could be anything like kidney diseases, heart diseases, and most commonly I see infections coming in. Infections like lung infections, skin infections, foot infections, and most commonly urine infections. These infections in uncontrolled diabetes can be sometimes very severe and even life-threatening. Foot infections can sometimes lead to amputations of your limb, which is a big morbidity. What can we do for this? First, let's see what are the reasons for poor sugar control in these patients. One of the most common reasons I feel is poor self-monitoring of sugars. So what you can do for yourself is monitor your sugars at home. It's very easy. The glucometers, I'm sure most of you will be aware of. There's a glucometer, which is a simple machine. You prick your finger and you get the result in 5 to 10 seconds. And you can see what is your sugar level, and that is how you can make out what control are you achieving with the sugars and whether you need to see a doctor. There's another device now available. Some people are scared of pricks. So there is another device that is available, and that is something we call it as a continuous blood sugar monitoring, which is a simple device which is put on the arms, and this, without causing any prick, monitors the sugar levels continuously. The other reason I see for sugar not being adequately controlled is doubt on the safety of medications. Many patients come and ask me, "Doctor, I've been taking these medications for so many years, so many months. My kidney will be affected. I don't want to continue the medications." We need to understand that it's not the medications which affects your kidney or your liver or anything for that matter. These medications, we have a lot of safe medications right now for diabetes, and these medications are meant to be taken lifelong, because diabetes is a lifelong disease. And these are generally very safe and do not cause any major side effects. There may be a very, very few exceptions, but otherwise most of these medications are safe. They do not cause any significant complication. The problem that happens to the kidney or to your heart or other things is because of uncontrolled diabetes, not because of your medications. Every food that you eat has some amount of carbohydrate, and if you have advanced diabetes, your sugars can still be high even if you're starving or even if you're fasting. So we cannot make out just basis on your diet control, we cannot say that you are going to be 100% sugar control. You need to check your sugars to know that your sugars are under control or not, if you are especially having an advanced diabetes. And I would say it's very easy to control diabetes. 90% of the patients, it's very easy to control. You need some diet control, which I'm sure most of you are aware of. Some exercising, which is at least 30 to 45 minutes of fast walking or cycling or treadmill, something like that every day. And of course, medications. So if you've been diagnosed with diabetes, you are living with diabetes, do not get scared. It's simple. Maintain diet control, do regular exercise, follow your medications as advised by your physician, monitor your sugars, and follow up with your physician regularly, at least once in 3 months. This will help you prevent any complications developing in the later life.